Hello, and welcome to another episode of the Health Bridge podcast. I'm your host, Holly B. Today, I'm talking with Stacey Roberts. She is a physical therapist and holistic registered nurse. Since 1990, Stacey Roberts has specialized in outpatient orthopedics, sports medicine, acute and chronic pain related to joints and muscles, pelvic health, and sexual health. Now, as a master's trained registered nurse, she combines her successful physical therapy skills, master's of nursing education, with a holistic approach. And she has expanded her practice at New You Health and Wellness with services dedicated to helping people feel better and be active longer. Stacey's specialty really is in addressing chronic pain and getting to the root cause of this pain. And we jump right into the very Western approach to pain, which is if I'm hurting, that's bad, and I need to turn off the pain by taking a pill. That is how we are trained in the Western mindset. And that is how pain pills and surgeries and very invasive things have really taken over the way pain is addressed. And Stacey has a much different approach. She believes in looking to the root causes of the pain and addressing those before deciding whether or not surgery is the right path for you. She believes, like I do, that there are many things that contribute to where we are in our health journey and what we're experiencing in our health journey. And if we can address the different levels, the different layers of things, rule things out, find our triggers, then we may be able to actually mediate, put into remission, get rid of some or all of the symptoms that we had been experiencing, no matter what label those symptoms carry. So, this will be a really great episode for any of you with chronic pain issues, whether you believe it's due to your autoimmune condition, to lupus, or from an acute injury way back when. Stacey will go through a whole range of things to look at to help you determine if there are things that maybe you haven't addressed yet that could be contributing to your pain, and other ways of looking at pain management for you. Also, keep in mind anybody that you know while you're listening to this episode that has chronic pain, that has joint pain, that is looking at surgery, please consider sending this or sharing this episode with them, because the more information they have, the better they can make the right decision for them on, what steps to take next in their pain management journey. Now, let's dive right into this episode with Stacey Roberts. Stacey Roberts, welcome to the Health Bridge podcast. I'm excited for our conversation today.
I am too. Thank you so much for having me.
You specialize in pain management, which is a big issue for people with autoimmune conditions. And I know that you don't necessarily specialize in autoimmunity, but we'll tie some of that into our conversation. But I want to start really with getting very basic. You deal with pain management, but what is pain?
Yeah.
Like, what exactly are we talking about here?
Great question. Something that, any type of symptom that would disturb you from doing what you would want to do due to, could be an ache, could be, a sharp sensation, could be an irritation, anything that would kind of stop you from doing what you would normally want to do, especially with movement, right? So that's, I've never really thought about the definition of pain, but that would be my guess as to overarching definition. But even more importantly, is pain is a message, right? It's a signal and a message from the body that we need to pay attention. And that is probably one of the things that we've moved away from as a society and moved more to, oh, pain is bad, I need to take a pill and cover it up. Whereas pain is really telling you that there's something going on and to pay attention to it so that you don't get worse, right? So that your body has a chance to heal from it. So by covering up that message, we often end up in a worse situation down the road.
Totally agree with that. What are some common misconceptions when it comes to pain and pain management? I mean, I know you just mentioned we have this societal push to, oh, there's pain, cover it up. Oh, there's pain, take a pill, take care of it. I certainly have been guilty of that, and was taught that at a young age and went by that for a really long time. Not saying I never reach for an ibuprofen anymore. I still do, but I'm much more aware of my choices when I do it. But yeah, if you could just dive into that.
Yeah. So in regards to what you said was fantastic in regards to agreeing with the societal push. But really when we're dealing with pain, what we have to think about in regards to the message is that we're instead of covering that up and listening, we want to understand our body more because we think of pain as bad. And okay, yes, it sucks to have pain 100%. But if we can stop and think, okay, where is that coming from? Why am I having pain? And I think one of the biggest things that people forget because of how we're conditioned is we are able to have control of whether we feel pain or not for the vast majority of the time. Not always, right? There's some things that are out of our control. And unfortunately, if we take more medication to dumb down that pain response, it becomes more and more difficult for us to be able to take control and address that pain because even the brain changes with chronic pain over time. So I think the misconceptions about pain, number one, is that it's always bad. And we need to look at it as a message. And when we're in the right mindset, because the other thing that pain can cause is a lot of stress and cortisol issues. And sometimes we're just not in the right mindset to be like, okay, what does this pain mean? Sometimes we're like, I just need to not have pain right at this moment. And that could be resting, that could be drinking water, that could be doing certain things to help calm the nervous system down, right? And that takes time versus it's a lot easier to grab a pill to cover it up.
You
And
said a few.
even if, like you said, even if somebody takes ibuprofen, even then or one of those medications, when that pain is better to stop and say, okay, I got to figure out where that's coming from so that I don't have to keep doing something that I don't want to do.
Right. Yeah. Sometimes we need to interrupt that pattern so we can then focus on, being in less pain so we can figure out how to, what the origins are, like you said. But you said a couple things. One was that there are actual brain changes that can happen from taking pain meds. Can you talk about that?
It's more about, well, a couple things from taking the pain medications, what can happen for both NSAIDs and things like opioids and others. There's questionable whether this is happening too, is that it makes you more hypersensitive to pain. So the very thing you're trying to get away from by taking those medications becomes actually worse as a result of taking those medications over time. And, everybody knows about the opioid crisis and the fact that, when they're taking when people are taking opioids, they would build a tolerance to it. So then they needed more. And then when that would wear off, the pain would actually be even worse than it was before. So it's easy to see why people can get addicted. So same can be true, not to as much of an extent as the opioids, but same can be true and has been shown in research to say that if you take the NSAIDs, like the non-steroidal anti-inflammatories on the market for long periods of time, then you can become hypersensitive to pain as well too. So that is a big deal that most people don't understand. And even if you are shutting down the pain response in the beginning of an acute injury, a very fresh injury, there is research to support that you're more likely to develop chronic pain in the long run because you're slowing down the body's natural healing process.
Mm, that makes a lot of sense. My story with NSAIDs goes back to when I first started my period and I had horrible cramps. I mean, hot sweats. Like I had never experienced obviously anything like that. And my mom took me to the doctor and he said, oh, well, try just taking some Aleve. at the very first sign of cramps. And I did, and it worked. And I was like, this is my miracle drug. Like,
Right.
and from then on, I had it on me at all times. And anytime I feel, whether it was cramps or a headache or anything else, first sign of pain, I would shut it down and I would take a pill. And I was like, oh, people don't have to be in pain. And if I met, if I had a coworker or something that was had a head, like, take some here, take some of this, this will help. Like, you don't have to be in pain.
Oh,
And
yeah.
I mean, that went on for ages, and I weaned off for the most part. I might take ibuprofen once or twice a month for a headache around a cycle or something like that. But, you know, even then, I don't always find that I need to take it.
Right. Yeah.
And
And
so
there's,
it's a process.
yeah, exactly. There's a story that I tell in my book that really changed the way, or really made me recognize the way how society has changed because, I was born in the 60s, mid to late 60s. And, growing up with my parents, if I had a headache, it would be like, go drink some water. Here's a banana, go outside and play. Those things were the way that we managed pain. And my mom was a nurse too. So it wasn't, she was actually more about not, taking medications. And there certainly weren't as many medications available when I was growing up that there are now. And then I moved overseas and I lived in Australia for a while. And I came back and I'll never forget this. It was probably, gosh, early 2000s, maybe late. Yeah, probably early 2000s. And we had arrived in LA and we had to all get into a bus to get to the next terminal. And it was a 14-hour flight. So everybody's tired and most likely dehydrated and everything and crunched together in this bus. And across from me was a boy, probably about the same age as my son at that time, and about 10 years old ish. And he had his head in his hands and he's like, oh, my head, it hurts. And, his mom, starts rustling in her bag and her purse. And sure enough, brings out a bottle of something, right? Hands him a pill and he shakes his head. He's like, I don't want it. And she's like, take it. And he's like, oh, I don't want it. And she's like, take it, and he's like, no. And so she grabbed his arm, pulled him in, and he finally took his head out of his hands and looked at her. And she's like, take it. And so he took the pill, popped it in his mouth, and she gave him a glass. She gave him the thing of water, which I was like, well, why don't you just give him the water? But at that point in time, it really changed my paradigm about, wow, this is really how it's changed over time, and this is how we're conditioning our kids because this is how we were conditioned. My son's friend came over to our house once, and he was probably about 11 or 12 at the time, and he had a headache and he's like, do you have any medication for it? And my son's like, no. And he's like, what kind of a house doesn't have, this type of medication? So I just said, hey, I could tell his blood sugars were low. So I'm like, hey, have some, fruit and drink this water. And sure enough, he was fine. But again, even at that young age, they're just used to, again, because we as parents are conditioned, then we're also conditioning our kids as well too, or going to a doctor's visit like you did as well.
I have another story actually that I'd forgotten about. I was chatting with a friend of mine a couple of years ago who, I don't know how it came up, but she said, oh, when I can't sleep, I just take Tylenol. I was like, what? Like that. I never heard of, taking a Tylenol or an ibuprofen to help sleep. And she's like, well, that's just what my mom always told me to do. So that's
Mhm.
what I always do. And we
Yeah.
were actually in a garden, and I think I was maybe still in herb school at that point, and there was California poppies growing in the garden. And I was like, well, your sleep medicine's right here. What?
It's so true. We're so disconnected from that, though. I mean, that
Yeah.
should be that in the past was, the first thing, even in the way past, that was the first thing even medical doctors would think of. And now that's not even a line in their medical textbook, right?
Oh yeah. Now it's all woo woo and old wives' tales. Yeah. Hmm.
Yeah.
So, what do you want everybody to know about pain management? really quick, Holly B here. I just wanted to interrupt the podcast to ask you for a quick favor. Can you take just a moment to like and subscribe to this podcast on whatever platform you are listening in on? It makes a world of a difference. And the reach of this podcast, it takes like literally under 10 seconds. So go do that right now. Thank you so much. I really appreciate it. And now back to the episode.
Well, I think again that we can be accountable, and that because otherwise, if we don't feel like we can make a difference, we feel disempowered, right? We feel like there's nothing we can do. Because a lot of times it feels like that, right? It gets to the point where it feels like there's nothing we can do. But when we have the bouts where we're feeling better, to be able to search out some things like natural, herbals that are able to address things, that's great. What are we doing maybe in our diets that are contributing to pain, that's causing, gut issues, that are, which is, I know I don't have to tell you this, but 1,000% common with autoimmune issues, right? Addressing gut stuff. And looking at, your eating plan, even food sensitivities. Some people, for me, even good foods are causing me food sensitivities where I get pain in my back and down into my leg. Um, you know, I had aching, I had spinach smoothies and I was having aching in my hands. I did a food sensitivity test and guess what came up as severe spinach, right? So we have to start when we can, when we're able to emotionally look at those things. What else could be contributing to the pain? Now, most of my patients come in and it's a localized issue that they have. So 70 to 80% of them will do really well with what we call soft wave therapy, a type of shockwave therapy. Excellent, excellent. I've never seen the results that I have in 34 years of PT since the last 5 years that I've been using soft wave therapy. It just really accelerates what I do as a physical therapist, by decreasing inflammation and helping the patient get better faster. And when you accompany that with taking away triggers, like if it's a biomechanical issue, get them moving more efficiently and better, that does really well. But then there's the 20-30% that don't get better, or they get better and it comes back, and they get better and it comes back. That tells me there's more of a systemic issue because we're getting rid of the localized inflammation and then the body's just kind of filling it back up. And that's what's really common with my patients who have some autoimmune issues, especially if their pain is not resolving. Then we shift and we look towards, okay, what can you do? What can you do in your life? And it is kind of a resistance sometimes because patients are not used to having to do things for themselves instead of looking outside for, like, even herbs, like, what herb can I take? What pill can I take? But well, first, maybe let's look at some other things first, right? So that, and I look at it as empowering yourself to realize that you can make the changes, because even making those changes and changing your beliefs rewires your brain, right? The concept of neuroplasticity, being able to, change things in your body and change things in your brain, by changing your beliefs about your pain, that starts to rewire your pain. Starts to rewire your brain and help you be able to be more empowered to address it.
I agree 100%. For me, in my journey, learning that I could shift my beliefs around my health and around my life was a game changer and completely just shifted the trajectory, both in my experience of health and in my experience of my life and where my life is headed.
Yeah.
And so I always address that first with my clients because I just think that's so important. And it's it's the layers of an onion, right? That's an ongoing process. But it's part of life's journey, I think. But acknowledging that that is a key element in healing and in pain reduction, pain management, I think is really important. I mean, people like Joe Dispenza are doing miraculous things, helping people rewire their neural patterns and their thoughts and their belief systems. And you're having full reversal of, you know, diseases that aren't supposed to be reversible. So
Right.
there's a
Exactly.
huge power in that.
Oh,
And what else, and what else? And what can we do to shift other things in our life, our nutrition, our, like you said, like biomechanics? Is there something that we're just physically doing that we don't realize we're doing that's
right.
creating something off in the body?
And like you referred to before, some of the stuff was considered woo woo, and it still is considered woo woo, but there is research, and the research is growing that, these are uh, under our control, right? Our thoughts and our beliefs, everything like that, it can wire our brain in a certain way. It's like driving down a highway the same way to work all the time. We have that habit. Well, that habit and those patterns are created in our brain as well too. And the old, beliefs don't, just disappear. We just have to continue to reinforce them. And that's, again, proven in research, over and over again now. It's just not common knowledge for people to understand that.
Hmm. And I'm so glad that you are educating your clients on this. And I'm sure that your book goes into this in depth that's coming up, which you're coming out with the pain-free formula book. I
That's correct.
think releasing, you said, the same week that this podcast releases. So that's really exciting. Um, what do you get into in the book? Do you walk people through a process?
So I divide the book into two parts. One is the way conventional medicine is dealing with pain right now and why it doesn't work for some people. So I talk about what we've talked about in regards to NSAIDs, pain meds, talk about how to reframe your thoughts about what pain is, right? Like one example, a friend of mine, Jack Canfield, has talked about if you take a pill for pain every time, it's like taking the batteries out of your smoke alarm, right? The fire is still going to be there, right? But you're just ignoring it, and then it becomes bigger and bigger, and potentially, becomes something that feels like it's too big to handle, right? So we talk about the conventional medicine. We talk about surgeries. The fact that a lot of surgeries are done too quickly, and there's research to show that a decent percentage of surgeries that are done are unnecessary, but people aren't given options, so they think that that's the first thing to do. We also talk about different, injections that people get, different medications and things, and what they actually can do in the long run. Like cortisone has now been shown to degenerate joints, and we, often think, okay, well, I'm going to go to the doctor, get a cortisone injection, and feel better for a couple weeks or a couple months or whatever. But then, what is that doing to people long term? And then part two goes into, and I want people to understand when I talk about that stuff, it's not about that I am against it. It's just that I think that you and I should have the education to be able to make an informed choice of what we want and what we want to continue doing versus, this is your only option, just do it because I said so, right? So then the second part goes into what we've alluded to already is what other things can you do to address pain? If the conventional medicine way of doing things isn't working, we talk about the way that we move, right? You may have moved this way for 50 years and then you fall over and hurt your back or hurt your hip, or, you're playing pickleball and you hurt your elbow. So that movement pattern now may be a trigger to that pain not improving, going away. So let's look at your movement pattern. Let's see how we can change it and adjust it, and maximize it, and understand that just because we see something on an X-ray or an MRI doesn't mean that that's actually causing the pain, right? That's a really big thing that patients feel resistant about. But oh no, it's on my MRI that I have this issue. I understand that. However, when you had the back surgery to fix that issue, you still now have the pain that you had beforehand, right? So helping people understand that that's information, but it may not be relevant information. So then we go into soft wave therapy and what I do in regards to soft wave. And then we talk about gut health. We talk about food sensitivities. We talk about hormones and how hormones can contribute to pain, either too high or too low of hormone levels, perimenopause and in menopause, pain, joint pain, and muscle pain are just as common as hot flashes, which you don't really ever hear about. And then what else do we talk about? Then we talk about food sensitivity, we talk about stress and pain, and then we talk about the brain and pain. And within each of those chapters, we give information about what people can do. And then I've got ebooks that really go into like step by step. So if you feel like, oh, after I read this, I think hormones might be my issue, then the ebook is there to give you kind of that step by step instruction what to do. I couldn't fit that in the whole book because it's already 380 pages. So I was like, dear God, nobody's going to buy this thing if I put more information in it.
This sounds like an amazing resource for people, and I hope everybody definitely gets your book so they can read more.
Thank you.
And I know we're getting close to time, but I want to dive into a few of those things that you brought up. Talk to me about hormones. and pain. I'm in the perimenopause era, and
Welcome.
thank you. And it can be confusing because it can be really hard to differentiate. Is this pain or weight gain? Is this because actually of my autoimmune condition? Is this because I'm in perimenopause and my hormones are off? Is it all of the above? Is it because I'm not moving as much because my job has shifted and now I'm sitting more? There's
Mm.
so many different factors, and I'd love for you to weigh in on how
Sure.
to differentiate that.
It's like we need to have a chat after this too.
I know.
So after April 5th, if you're listening to this, I will have a pain-free formula quiz. So you'll be able to answer questions that will kind of guide you to where the pain potentially is, whether it's a localized issue, whether it's potentially related to hormones, gut health, all that type of stuff. So that can give people a little bit more of information in regards to, where do I start, right? So if I'm sitting in front of a patient and we're going through their extensive health questionnaire that they're filling in, I get a sense, because I've been doing this for so long, of, okay, based on what you're telling me, we're probably going to be looking more at hormones along with this. But here's my belief based on my experience is even hormones right now, hormone replacement therapy has been shown to be safe and can be very effective compared to what it was thought to be in the early 2000s. But now what's happening is like surgery is given oftentimes as the first line. We're thinking, okay, you're in perimenopause. Well, let's just start you on hormones. Okay. Now that may be perfect for a lot of people, but if, like you're saying, where is this pain coming from? Where are these symptoms coming from? If it's coming from, let's say, something that you're eating that now, because your hormones are lower, when hormones are at their sweet spot for people, and everybody's a little different what that is, they are an anti-inflammatory. They are a natural anti-inflammatories in our body. So estrogen, progesterone, when they're well balanced, both of those can help significantly with decreasing muscle pain, decreasing joint pain, allowing us to do more things. Same with testosterone for men. When those lower as we get older and go through those transitions, we lose some of our natural anti-inflammatories. So those were kind of hedging our bet against maybe not the best diet, or maybe over exercise or moving, like I was talking about before, inefficient movement patterns. So now we don't have that protection. So now the pain comes up, right? So we think, I'll take the hormones, get that back up. Great. Okay. Some people do that right away, but then maybe 6 months down the road or 12 months down the road, all of a sudden these things start coming back because we didn't take care of the true underlying issue first. So what I tell my patients is, look, let's look at your eating plan first. Let's look at your gut health first. Let's look at your movement patterns first. We take all those things, and if you're still having issues, then that's the perfect time to add in hormone replacement, because then that will give you the best bang for your buck for the long term. If you don't do those other things first, the hormone replacement can give you honestly immediate relief. So if I'm seeing somebody and they're a mess, like if I tell them we're going to do a food diary and they're literally like, I'm going to choke you because I can't even, sit up straight right now and to have a conversation, then we would potentially start them with some hormones to get that anti-inflammatory effect up, and then move into looking at their eating plan. But that's not the way it's typically done. It's typically, here to take these hormones, you feel better, forget about everything else until something else happens, right?
Yeah. The easy route.
Right, exactly. So it's a little bit more, again, taking on the responsibility of, okay, I'm going to address these things and then move forward. So, and some people choose to get off the hormones, some people choose to stay on them. But if they're addressing those other things like gut health and food sensitivities and movement patterns and all that, they're going to be feeling pretty darn good, after addressing those and then deciding whether they want to stay on the hormones or not. And some people do, and some people don't. So it's just a much more holistic view, and trying to figure out what's the underlying cause first. And some people say, well, the underlying cause is perimenopause. That's why I have these issues. Well, yes and no, right? So even myself, I've started hormone replacement because over time I went through menopause without any issues as far as hot flashes didn't have them, weight gain didn't have it. All the stuff, vaginal dries, never experienced any of that. And I attribute that to, because my mom had horrible, horrible menopause. So I attribute mine to watching what I'm eating. I'm not perfect, but I know what I need to stay away from and what I need to have in my eating plan. Obviously, I'm a PT, so I'm constantly working on movement patterns, food sensitivities, all that type of stuff, working on stress and managing that as best as I can. And I really believe that got me sailed right through. But recently, I felt like, man, my joints are feeling just, they shouldn't be feeling like this. So I've started hormone replacement at small dosage, and my joints now feel much better. And I'm confident that because I've done all the other things, I'll be able to maintain that, because that was kind of I use the hormones as a last resort and not the first line typically.
Hey, I just wanted to jump in here and interrupt the program for just a hot minute. You know that I'm so passionate about this podcast, but what I'm also really passionate about is helping women with lupus minimize their symptoms, boost their energy so that they can indulge in life again. So if you are a woman who is struggling with lupus, who is sick and tired of being sick and tired, who's struggling to manage your flares, if you're finding that your lupus symptoms are just really getting in the way of you being able to live your life the way you want to, I feel you. I've been there myself and I felt the same way. And what I've found is that there are a certain set of health fundamentals that, once applied, will support you in your foundational health. They will support you in building and maintaining that energy, minimizing flares, and allowing you to, again, indulge in life and follow your passions. So, if that is something that you are interested in creating for yourself, let's jump on a call together. I will walk you through the process that I use with my clients to get them from sick and tired to strong foundation of health by implementing my Health Bridge protocol. If this is something you're interested in chatting more about, I would love to talk to you. Apply for a free clarity call with me, and I look forward to getting to know you soon. And now back to the episode. I think a lot of what I'm hearing you say too is like, again, getting back to that root cause and being curious and being open-minded as to what it could be. So instead of just that blanket of, oh, it's just because I'm in perimenopause, I need hormone replacement therapy. I take the same line with the autoimmune conditions. It's like, oh, well, this is all because of lupus. Well, but is it though? Because, it could be like, let's address, like, just like you do, let's address your diet, let's address your hydration, let's look at your circadian rhythm, let's look at all these other things that are really your foundational pillars of health, dial those in, and then let's see where your symptoms are. And then maybe some of that is also from lupus.
Right. And lupus is the label that they put on all the symptoms, but not the necessary underlying cause that contributed to the lupus, but it's the end effect, right? But we've got that kind of reversed when we think about regular conventional medicine, typical, right?
Yes. So with somebody, if somebody with lupus, for example, came in and they were having pretty debilitating joint pain, muscle pain, and they're like, I have lupus, this is what I'm dealing with, and I take all these pain meds, how would you start to work with somebody like that?
So I'm not going to lie, it's challenging, right? First, we would work on that paradigm that they have, that belief that they have that there's nothing they can do besides take these medications. But if they're seeing me, they're most likely open to doing something different anyway. So we would start with the area that is the most painful, or that we both agree on is probably localized, right? So did you have a fall? Did you have, those types of things? So then we would do our soft wave therapy, because that also helps us determine what structures are involved as well. So then we do the soft wave therapy to decrease the inflammation. And I have a talk with them, same as what I said a few minutes ago, is that, look, you have an autoimmune condition, which is systemic. So if we are able to maximize your body's ability to heal for this area that is now potentially injured or at least irritated, and the pain goes away and it stays away and it's 50 to 100% gone by that third or fourth treatment, it's probably a localized issue. But if every time I treat you, you feel like, oh my gosh, that feels great, then you come back and like, yeah, it's back, Oh, I felt pretty good for 3 days, but then it came back. Oh, I felt good for 2 days and then it came back. It's probably systemic. Something systemic is perpetuating that pain, even if it was due to trauma, due to a trauma like a fall or something. So then once we get to that point, and I'm giving them the information to try to understand that, teaching them about how the gut works, what leaky gut is, or increased intestinal permeability. And then we start easing in doing a food and symptom diary. So then we go, okay, let's see how your symptoms flare through the week, but I want you to compare what foods you're eating over that time. And if they want to invest in what's called the food sensitivity test by LCAT, then we do that because it just gives us specific information right away. But not everybody wants to spend the money to do that right away. So that it's much cheaper to just write on a piece of paper what you're eating all day and how your muscles and joints felt. And then we make that kind of comparison. Then we also will look at, depending on if the person is perimenopausal or where the person's at and what their history, even if they're not perimenopausal, but their history, like you, was excessive period pain, what was going on with their cycle. Those types of things tell me that there was probably a hormonal imbalance at some point in time. So maybe we need to look at hormones as well, too. So we take them methodically through those different steps to address, and then all the while working on how they're looking and feeling about their pain so that they can start to, without directly doing anything, start to change those patterns and belief systems in their brain. Because I know that people who experience autoimmune issue, again, to be the conventional route, it's very much a belief system that you're completely disempowered. There's nothing that you can do about it. And it's just happened to you and that's it. And that's your lot in life, which, I'm sure you would agree with me that that's not necessarily true for everybody.
True. Yes, I do agree with you on that for sure. And I've seen, miracles happen. I've seen changes in myself. I've talked with many women who have had lupus who no longer have any signs of lupus. I mean, I don't put any limits on what can happen.
Mhm.
So, but when you're in the thick of it and you're going the Western route, which I'm not telling anybody to not also use Western, 100% go for that. Talk with your doctors,
Mhm.
being monitored. Like I just did blood work today, I still get monitored. Um, but in the Western mindset, it's completely incurable. And that's what they're drilling into you. So just like they're drilling into you to take a pill for every ache and pain, they're also drilling into you that it's incurable and you're stuck with this for life. And it's your choice to believe that or not. It's your choice to go along with that or not.
And what's often then reinforced, if you're like the person you're talking to, or they no longer have any symptoms, it's either, well, it's still there, so it'll most likely come back, or you were misdiagnosed in the first place. You probably didn't have it, which again is totally disempowering. So it is. And I think I stated this earlier, I'm not against conventional medicine. I have one foot in conventional, one foot in natural. And I think that's what a lot of patients like about coming here to see me, because and my colleagues here, because we do have that kind of balance of what we do, and we'll work around as best as possible what people are needing to do from a conventional approach and what they can have from a complementary approach too.
We have about 5 minutes left. Real quick, rapid fire. What about surgeries? Because I know you talk a lot about surgeries and whether or not they are needed.
I don't know if we can do this in rapid
I
fire, but
know.
surgeries. So there's a couple things I'm actually just recording a podcast about this, a two-part podcast. One is talking about sham surgeries. So what I think people need to know, which again helps to open up their brain to different possibilities, is there are surgeries out there, and there's a study with over 1,500 participants in it, when they did a sham surgery for pain, meaning they just poked a hole in you and told you had the surgery, but you didn't because you're under anesthetic, versus actually doing the correction of whatever it was for knee or back or whatever it was. 79% of the people in the sham group had improved pain versus not even close to that amount in those who had the actual issue. So from that point of view, again, even though we're trying to fix what's on that X-ray or that MRI, we have to understand that it can be oftentimes be more than that. And surgery isn't, again, always the number one answer. So that's the sham surgery part. The other part is, how do you know if you need to have surgery? Well, if you're like my friend who stepped off a pier and shattered her humerus or upper arm into 10 pieces, where so much so that it wasn't even connected to her body anymore by the bones, yeah, she needs surgery. There's no question about it. I send patients after they've gone through the biomechanics. We've talked about their eating plan. We've done the hormones. If they're still not any better or not even progressing, I'll send them to get a surgical consult. So, so if you're with somebody who is providing care to you that helps understand that pathway of do you absolutely need surgery now, or are there other interventions that can be done? I again, am supportive of surgery for people say, look, this is my MRI. Well, if you have a completely torn rotator cuff tendon, chances of, or tendons, the chances that you're going to be able to lift that arm and do what you want to do are pretty slim. So yeah, I would do surgery and then come back and we can talk about those other things, especially if it's due to, again, a trauma, like a fall or a car accident or something like that.
I know you have to get to your next patient. So tell everyone where they can find you. Do you do online consultations for anyone that's not in your area? And then where can they get your book?
Yeah, so they can, if they go to our website at that's NEWYOU, healthandwellness.com. They can contact us through the website. They can also see what we treat and how we treat. We give a lot of information on the website. We have a health tips blog as well, too. They can email info at newuhealthandwellness.com. And to answer your question, yes, I do telehealth. So I can help guide people through, obviously we can't do soft wave therapy or manual therapy like we do via telehealth. AI isn't that good yet, but I can do something through the screen. But I can, again, give guidance as to what next steps, almost like coach them into what to look for and how to find the best physical therapist, or how to find soft wave therapy, or the best biomechanical analysis, or what to ask your doctor or gynecologist about hormone therapy, or which tests to go and do your hormones, or gut health testing, food sensitivity. So we can go through all those things as well. And
Excellent.
my book, The Pain Free Formula, that'll be available on Amazon. Hopefully when this episode has dropped, so they can get that on there. And then eventually it'll also be an Audible, hopefully by the fall.
Awesome. Thank you so much, Stacey. This was so much information packed into a short time. I really appreciate having you on.
No worries. And I hope that I can have you on my podcast at some point too.
I would love that. I would love that.
Thank you, Holly.
Thank you. Oh man, I could have talked with Stacey for another few hours easy. She's lucky she had a patient to get to. Otherwise, I would have kept going and going. But we talked about so much there. Something that I want to get back to that she said was, it's really about making sure each patient is making an informed choice. And that's such an important topic right now, especially. I mean, it always has been, but we have RFK in office now. Whether you like him or not, he is all about informed choice. And I think that finally our voices are starting to be heard a little bit in that, with all of our health journey, no matter whether we're talking about vaccines, whether we're talking about surgeries, whether we're talking about medications for autoimmune conditions, whether we're talking about, I mean, this is honestly making me think about when I had my eye surgery. I don't believe that I was given all of the information to really make an informed decision on whether that was the best timing for me to have surgery or not. What we're talking about is just informed choice. We need all the information in order to make the right decision. And unfortunately, we don't always know what we don't know, right? Which is why we don't always know the questions to ask, or that we should be asking more questions. So, Stacey Roberts' book that just came out as this is released, the pain relief formula, solving the puzzle of muscle and joint pain without surgery, drugs, or injections. This book is going to be huge in helping anybody in that circumstance have much more of an informed choice and an understanding of where their body is within that process. She will help give the questions, to ask your doctors and so forth. So please consider getting that book for yourself, for a friend that's going through it. And please, again, share this episode with somebody that you know that might need to hear it. Also, she talked a lot about, of course, getting to the root causes and looking at lifestyle factors that are at play in the pain, right? In causing this pain or perpetuating this pain. And if you are on your autoimmune journey, that is what we do in my program. We look at all of the basic fundamentals of health and see where you are in each of those pillars and see what we can dial in so that we can minimize your flares, increase your energy, help you be able to just have a better quality of life again. And then we'll see where your symptoms lie, as I said earlier in the episode. So if you're ready to see what that might look like for you, whether coaching is a next right step for you, or just, you just have some questions about my program and working with me, let's jump on a free call. I would love to chat with you. You can find the link for that in the show notes here, and follow me on Instagram at I am Holly Beck and reach out to me there as well. I would really, really love to connect with you. Thank you so much for listening to this episode of the Health Bridge podcast, and I look forward to seeing you next week on our next episode.